everyone, welcome to the first ever episode of Wellness Wednesdays. I am your friendly neighborhood doctor, Dr. Samprita Pradhan, and I just wanted to start this series to share with you my insights that I have gained as a transfusion medicine resident in this past 1.5 years. Because transfusion medicine is just not blood donation and blood collection, it is so much more. We do therapeutic procedures, we do stem cell collection procedures, we do therapeutic apheresis. We will also be talking about rare blood groups and rare blood donors. And I'm sure that you will enjoy this exciting and enthralling journey because I do myself enjoy this. And the sad part is this subject is actually not taught in the MBBS curriculum. So I just want to do my bit in just sharing my insights with every one of you. And I hope you enjoy it because I truly enjoy making these kind of videos for you. So without further ado, let's start today's episode. We all have heard of the quote, blood is thicker than water. But actually, this is not the complete quote. So, the complete idiom goes something like the blood of the covenant is thicker than that of the water in the womb. So, this means that the bond that we have through shared experiences is much more stronger than our familial ties. So, today we will talk about the power of giving. And what better than the gift of life, right? So, today we are going to dive into something that literally can save somebody's life. So, one unit of blood that is donated, it can save up to 3 lives. So, that's why this is the reason I do not like to call my blood donors, because to me they are no less than superheroes. Okay, so they, for me, they are superheroes, right? So today we will debunk some myths, go through the criteria for the blood donors, and we'll also figure it out that why donation matters, and why do we need to donate blood, and why do we need to do this selfless act, right? So without further ado, let's get started. So whenever you walk into a blood bank or a blood donation center or to even a blood donation camp, you are given a big form, right? It has almost 20 questions in it, apart from your demographic details. So let's go step by step why demographic details are important. So in demographic details, पहले आता है आपका नाम. नाम जानना जरूरी है बिकॉज पर्सनली हम भी आपको नाम से एड्रेस करना पसंद करेंगे, राइट? वेदर यू आर अ मेल और अ फीमेल, right? Then you also have age, your date of birth, your age, phone number and address. Phone number and address is for communication purpose. Age, क्योंकि blood donation का minimum criteria है 18 years, which is the legal limit. So anyone who's above the age of 18 years, you can donate. So एक कट ऑफ भी होना चाहिए ब्लड डोनेशन का, राइट? कट ऑफ है 65 years. बट इसमें एक ट्वीक है. अगर पहली बार आप डोनेट कर रहे हैं तब आपका कट ऑफ हो जाता है 60 years. मतलब क्या है? फॉर एग्जाम्पल, अगर कोई मेरे पास आ रहा है ब्लड डोनेट करने के लिए और उनका एज है 61 and 62, फॉर एग्जाम्पल, in that range, 62, let's consider it 62 for the ease of this conversation. Can I take his blood? He's the first time donor. Should I take? No. In that case, my lower limit comes down to 60. Now, these criteria were revised this year, right? That is on 24th January 2025. So all the things that I'm going to talk to will be based on these criteria. Now every blood bank follows these criteria because they are given by NBTC, National Blood Transfusion Committee. तो एक कमिटी बैठती है, वो डिसाइड करती है कि क्या क्राइटेरियाज में रिवीजन आना चाहिए. कम्स द वेट क्राइटेरिया. वजन कितना होना चाहिए. अगर आपका वेट 45 किलोग्राम से ज़्यादा है तो आप ब्लड डोनेट कर सकते हैं. सो अगर आप मेल हैं और आपका वेट 45 टू 55 किलोग्राम है तो 350 ml ऑफ ब्लड कलेक्ट होगा. अगर 55 किलोग्राम से ज़्यादा है तो 450 ml ऑफ ब्लड कलेक्ट करते हैं. ये सब लिमिट्स आर वेल विद इन द सेफर लिमिट ऑफ डोनेटिंग ब्लड. सो ऐसा नहीं है कि हम आपसे ज्यादा ब्लड कलेक्ट कर रहे हैं. दिस आर वेरी सेफर लिमिट्स, ओके, which are provided by the guidelines. Okay, these are the Indian guidelines that we follow. But if you are a female, irrespective if your weight is more than 55 kilograms, if it is more than 45 kilograms, of course we are going to accept you. But irrespective whether it is 45 or 55 or 65, 350 ml of blood will be collected. Okay, now we'll come to the interval which is required between two donations. So a male can donate every 3 months, which is 90 days. But for females, to be on the safer side, since we have the menstrual cycle and everything which happens and occurs every month, they have made the guideline as 120 days, which is 4 months. So for males, it is 3 months of interval between two consecutive blood donations, and for female, it is 4 months between two consecutive blood donations. हीमोग्लोबिन क्राइटेरिया. जिस किसी का भी हीमोग्लोबिन मोर देन 12.5 ग्राम्स पर डेसीलीटर है, बिकॉज वी डू कैपिलरी मेथड ऑफ हीमोग्लोबिन एस्टिमेशन. सो उसमें अगर हीमोग्लोबिन मीटर में आपका ब्लड वैल्यू हीमोग्लोबिन का आता है मोर देन 12.5, वी कैन एक्सेप्ट यू एज अ डोनर. ओके, एंड आवर हायर कट ऑफ फॉर हीमोग्लोबिन इज नॉट मोर देन 18.5. मतलब 18.5 तक हम आपको एक्सेप्ट कर सकते हैं. अगर आपका हीमोग्लोबिन उससे ज्यादा है, then sadly we cannot accept you as donors. Okay, why? That we will discuss on a later date. But just to close this statement, it is because there are risk of polycythemia that you may have. Okay, so we don't know whether it is because of a mutation which is called JAK2 mutation. Okay, so that is why we will not take any person who has a hemoglobin higher than 18.5. If it is equal to 18.5, yes, 12.5 to 18.5, irrespective of male or female, we can accept the donor. Now there is one more thing. People ask us, what if we have thalassemia trait, can we donate? Yes, if you have thalassemia trait, you can donate, but your hemoglobin level should fall well within our limits. Okay, it should not fall below, or it should not be more than 18.5. Yeah, while you donate blood, हम आपका ब्लड प्रेशर भी चेक करते हैं. अगर ब्लड प्रेशर सिस्टोलिक 100 to 140 mmHg है, then you can donate. और अगर डायस्टोलिक 90 तक है, then also you can donate. We also ask you that did you have your last meal properly and at what time? So the significance of this question is, we don't want you to have an interval of more than 4 hours between your meal and your donation. Okay, we do not want you to be hungry, or having low BP or something and then you have a reaction. We don't want that. We want you to be safe. Okay, your health is our priority. That is why we do not encourage if the gap between meal and your donation is more than 4 hours, right? So for these, we might ask you to go have something and come. But please be mindful that have a light lunch or a light breakfast, right, before you come and donate. Please do not have high fat containing food when you are coming to donate, or do not have food immediately and then you come and donate, because then what happens is the lipid in your blood increases, right? So what it will have is, it will the we will collect the blood and we'll separate it into components. So the plasma that we separate and prepare, that has very high lipemic, it is very lipemic, and the lipemic index is also very high. So that plasma cannot be used to give to a recipient, right? And we do not want wastage of any blood or blood products. So please don't have anything very very heavy or very fatty. Have a healthy diet, maintain a healthy diet, have something healthy, eat and come, and please donate. And don't make the interval between your meal and your donation more than 4 hours. The reason we ask you about occupation is because people who are working as crew members in flights, or you who are long distance drivers, or who are above or below sea level divers, and personnel who are involved in emergency services. Um, so the guidelines ideally say that you should not donate between 12 hours of your duty, right? Because and you should not resume work also for 24 hours after your blood donation, okay? Because there are risk of adverse donor reactions that can happen. You can feel a little dizzy, you can have vomiting, you can have excessive sweating, you can feel little chills, or it can also escalate to seizures. We don't want you to have any adverse donor reaction. That is why we have maintained these guidelines. We follow these guidelines strictly. That is why whoever has done night duties, we have postgraduates coming to us and they have done night duty prior, and we tell them, we explain it to them that it is not advisable to donate now. Please have peaceful sleep tonight, and then tomorrow morning you can come and donate. Coming to high risk behavior, it is a part of donor questionnaire. Please don't feel offended if we are asking you these kind of personal questions. It is to identify at risk behavior of some donors, okay? Just to maintain blood safety, we have to ask these questions. It is asked to everybody. Please do not feel offended. And in case if you are feeling uncomfortable at any point of time, please do let us know. We will try to provide you a counselor or somebody who can talk to you in your regional language, or in whichever way or form you feel comfortable. But we might ask you about your sexual preferences. We will ask you in the donor questionnaire about the healthy sexual activities of you as well as your partner, okay? Just to rule out any transfusion transmissible infections that can be transmitted by sexual intercourse. So any donor who is considered to be at risk of HIV or hepatitis B and C ideally should not donate. And any inmate of a jail or any other confinement is also not allowed to donate, and it is a clear cut permanent deferral criteria. Coming to the skin of the donor, yes, as transfusion medicine residents, we will have a look at everything. We will look at you. We will check your arms. We will check your cubital region. We will check for any needle marks or any skin induration, because this, when we are inserting the needle, that's called phlebotomy. So when we are inserting the needle to collect the blood, that area should not have any rash, itching, redness, or there should not be any induration, any infection that can go into the blood bag as a skin tag and then cause infection in the bag or anything. So we will have a look at it, okay? We will try to be very cordial to you. We will ask you if you have taken any allergy medications, or if you are having any allergies or anything. We will ask you such kind of questions. Please don't be offended or feel bad about it. These are routine questions which we ask to each and every donor. Yeah. but we also have to identify as transfusion medicine personnels that there should not be any, recurrent needle marks, which is seen with drug addicts and also habitual donors, right? Because they are barred from donating. Yeah, these kind of personnel should not be considered as a part of your regular blood donation program. Now, coming to the physiological state of a woman, that means the normal state, the normal physiological state of a woman. So, अगर आप pregnant हैं, तो क्या आप donate कर सकते हैं? Ideally, after 12 months of delivery, once you are done with your breastfeeding, then you can donate. Not before that. That is not an ideal situation. If you are menstruating, should you donate? If you are on your period, should you donate? Ideally, you should not donate if you are on your period or if you are currently bleeding. These are also a part of donor questionnaires, right? Which we keep on asking you. That is to know whether your cycles are regular or not. Are you under any medication like hypothyroid or hyperthyroid medication? Um, whether your bleeding is regular, it is irregular, do you have PCOS? These are all very regular questions that we ask to our female donors. And also abortion. Now, if you have had an abortion, can you donate? Yes, you can donate, but after abortion, please maintain a gap of 6 months and then you can donate. Yeah. So if a donor comes to me and he says that, doctor, I'm having cough, cold, fever, but I want to donate. Ideally, do not accept a donor at that time. We can donate he can donate after his fever has subsided, but ideally 2 to 3 days after the fever has subsided, he or she can come and donate. Any major surgery, so if a surgery has occurred within the 12 months, please do not accept a donor. After the completion of the 12-month period, that is after 1 year from the last day of the surgery, the person can donate. Yeah, he or she can donate. If it is a minor surgery, then our criteria is 6 months. So we also get a lot of questions that if I have a tattoo, can I donate? Yes, you can donate if the tattoo is not infected. If you have gone to a place where they have maintained sterility, you can donate. There is not a hard and fast rule that if I have a tattoo, whether I can donate or not. You can donate, that is absolutely acceptable, but please maintain a deferral period of at least 1 year. So if January of this year, if someone has a tattoo, then next year January they can come and they can donate. So if a person has had any cardiac abnormalities, like if they have had an heart attack या तो किसी को दिल की बीमारी कुछ भी है, सो उनको आइडियली परमानेंटली डेफर किया जाएगा. अब डेफर टर्म इसलिए यूज करते हैं बिकॉज हम रिजेक्शन नहीं यूज करते हैं. हर ब्लड बैंक एक डेफरल टर्म यूज करता है. दैट मीन्स हमने आपको एक्सेप्ट नहीं किया है एज अ डोनर. बहुत लोगों को माइग्रेन की तकलीफ भी होती है, तो इस सिचुएशन में क्या हम एक्सेप्ट कर सकते हैं उन डोनर्स को? Absolutely. We can accept donors who have had migraine, but they should not have migraine while donating. Sometimes the light also causes migraine. So we can dim the lights of the bank, of the blood bank if you want. We will try to make you feel very comfortable. But अगर आपको ऐसा लग रहा है कि आपको हेडेक हो रहा है या आपको बहुत तकलीफ हो रही है, so बेटर है कि आप एक दिन का गैप लेके वापस जब आपका तबीयत ठीक हो तब आप आके डोनेट करें. बहुत सारे डायबिटीज के पेशेंट्स भी आते हैं हमारे पास पूछने के लिए कि हम डोनेट कर सकते हैं या नहीं. अगर आप ओरल हाइपोग्लाइसीमिक ड्रग्स में हैं तो आप डोनेट कर सकते हैं, प्रोवाइडेड आपका ग्लूकोज लेवल कंट्रोल में है और 3 से 4 हफ्तों के बीच में आपके मेडिसिन में कोई ऑल्टरेशन नहीं हुआ है. अगर आपके फिजिशियन ने कुछ भी दवाइयों में कोई भी ऑल्टरेशन नहीं किया है तो आप आके डोनेट कर सकते हैं. हाँ, बट अगर आप इंसुलिन इंजेक्शंस में हैं, then it is very difficult for us to consider you as a blood donor. In that case, you can defer yourself. Okay, there's no need to donate, right? Please take care of your health first, prioritize yourself first, and then think about donating blood. अगर किसी को भी हेपेटाइटिस बी या हेपेटाइटिस सी है, तो वो परमानेंटली डेफर होंगे, मतलब हम उनको एक्सेप्ट एज अ डोनर नहीं कर सकते, ये गाइडलाइंस के खिलाफ है, हम उनको नहीं एक्सेप्ट करेंगे। बट हाँ, अगर किसी को हेपेटाइटिस ए है, उस सिचुएशन में जब आपका ट्रीटमेंट खत्म होता है हेपेटाइटिस ए का, उस डेट से लेके 12 महीने मतलब 1 साल तक आप डोनेट मत कीजिए। जब आपका पीरियड खत्म हो जाता है 1 साल का, तब आप आके अपने रिपोर्ट्स के साथ आइए और बोलिए कि इस दिन को, सपोज जनवरी को खत्म हुआ है, तो नेक्स्ट जनवरी को आप आइए और बोल सकते हैं कि 1 साल का पीरियड खत्म हो गया है, उसके बाद आप डोनेट कर सकते हैं, उसके बाद आपको एक्सेप्ट किया जा सकता है एज अ डोनर। अगर आपको कोई भी परसिस्टेंट लिवर का प्रॉब्लम है, तब हम आपको एज अ डोनर एक्सेप्ट नहीं करेंगे। बट अगर आपको जॉन्डिस है, तो 1 साल के बाद आप डोनेट कर सकते हैं, बिकॉज ऑफ एनी रीजन अपार्ट फ्रॉम ऑब्वियसली द aforementioned रीजन ऑफ हेपेटाइटिस बी एंड हेपेटाइटिस सी एंड chronic liver disease. You can donate if it is hepatitis A or any other infections that you are having, then you can come and donate. That is not at all an issue. मीजल, मम्स और चिकन पॉक्स के बाद अगर आपका फुल रिकवरी हो जाता है, आफ्टर द रिकवरी पीरियड 2 हफ्ते के बाद आप आके डोनेट कर सकते हैं। अगर आपको मलेरिया है, तो रिकवरी पीरियड के बाद 3 महीने के बाद आप आके डोनेट कर सकते हैं। अगर टाइफॉइड हुआ है आपको, तो वही 12 महीने मतलब 1 साल के बाद आप आके डोनेट कर सकते हैं ब्लड, हम आपको मना नहीं करेंगे, आप एक डोनर के हिसाब से एक्सेप्ट करे जाएंगे। डेंगू, चिकनगुनिया और जीका वायरस अगर किसी भी इंसान को है, तो उसका डेफरल क्राइटेरिया है कि जब भी आपका रिकवरी खत्म होता है, उसके 6 महीने बाद आप डोनेट कर सकते हैं। सो फॉर एग्जाम्पल, अगर कोई जनवरी में किसी को जीका वायरस हुआ है और वो रिकवरी पीरियड भी जनवरी में हुआ है, 6 महीने के बाद वो वापस आके डोनेट कर सकता है, क्योंकि रिकवरी पीरियड 6 महीने का, 6 महीने के गैप के बाद यू कैन कम एंड डोनेट। अगर किसी को टीबी है, मतलब ट्यूबरक्लोसिस है, तो जब आपने अपना रिकवर हो गए हैं, जब आपका रिकवरी पीरियड खत्म हो चुका है, उसके 2 साल के बाद आप आके डोनेट कर सकते हैं। बहुत सी लेडीज हमारे पास आती हैं कह के कि हमें थायराइड की प्रॉब्लम है, हम डोनेट कर सकते हैं या नहीं। सो इन दैट केस, इफ योर थायराइड लेवल्स आर विद इन द कंट्रोल्ड लिमिट्स, इफ यू हैव टेकन योर मेडिकेशन, you can come and donate. That is not at all an issue. Okay, but if you have any malignant disorders for any reason, please, it's not advisable to donate. It is not in favor of your good health. It won't be beneficial for you to donate. अब आते हैं वैक्सीन्स पे। अब कुछ वैक्सीन्स होते हैं जो लाइव वैक्सीन्स नहीं है, और कुछ वैक्सीन्स हैं जो लाइव वैक्सीन्स हैं। सो जो नॉन लाइव वैक्सीन्स हैं, जैसे टाइफॉइड, कोलेरा, इन्फ्लुएंजा, मेनिंजाइटिस, पर्ट्यूसिस का वैक्सीन, कोविड-19, द नॉन लाइव वैक्सीन, स्वाइन फ्लू का वैक्सीन, टिटेनस, डिफ्थीरिया, पोलियो, अगर आपने उनको लिया है हाल ही में, तो 14 दिन के गैप के बाद आप आके डोनेट कीजिए। बट जब तक वो 14 दिन का पीरियड कंप्लीट नहीं होता है, it is not advisable for you to donate. After 14 days, yes, you can come and donate. आपने लाइव एटेन्यूएटेड वैक्सीन, मतलब एग्जाम्पल्स के साथ अगर मैं समझाऊं, तो अगर ओरल पोलियो वैक्सीन किसी ने लिया है, मीजल मम्प्स रुबेला का वैक्सीन लिया है, येलो फीवर, जापानीज एंसेफेलाइटिस, इन्फ्लुएंजा का वैक्सीन, कोविड-19 का वैक्सीन जो लाइव एटेन्यूएटेड फॉर्म में अगर आपने लिया है, तो उसका जो डेफरल पीरियड है वो है 28 दिन, 28 days. After 28 days, you can come and donate. We will accept you as a donor. Coming to particular vaccines and anti-seras. Now, अगर tetanus vaccine, anti-snake venom vaccine, anti-snake venom serum, sorry, diphtheria, anti-gas gangrene, anti-sera अगर किसी ने भी लिया है, देन उसका डेफरल पीरियड 28 दिन है, 28 days. अगर आपको स्नेक बाइट हुआ है, then after 28 days you can come and donate, right? If you have taken TT vaccine or tetanus vaccine, after the 28 days period is done, you can come and donate. We will accept you as a donor. But if you have taken vaccines like hepatitis B vaccine or rabies vaccine, for that the deferral period is 1 year. So after completion of 1 year, you can come and donate. Now, lastly, we come to the medications. So, there are certain group of medications that you can accept as a donor. Like if you have taken some medicines, we can accept you as a donor. So, if you have taken oral contraceptives, then we will accept you. If you have taken any analgesics, then you can be accepted. That is not a hard and fast criteria that we won't accept you. If a donor has taken mild sedative or tranquilizers, we can accept. It is not a deferral criteria anymore. If the patient is having cholesterol lowering medications, then we can accept, but they should not be monoclonal antibodies. If it is not monoclonal antibodies, please accept the donor. If the patient has taken, which is a very famous drug, and people pop it like poppins nowadays, Dolo, you can accept, right? But not with, if the patient has, or if the the donor has taken Dolo, say today, and he has come to donate, then today don't accept the donor. You can accept him after 3 days. After 3 days, you accept the donor, right? If the donor has taken, again, salicylates like aspirin, again, avoid taking the blood that day. If he has taken today, avoid taking it that day. You can take it after 3 days. Now, antibiotics, as we all know, deferral period 2 weeks. After 2 weeks, they can come and donate. Now, if a donor has had hair transplant or PRP procedures or skin graft, then the deferral period is 6 months after the recovery, and only if there is no other treatment required. If the treatment is completed, then from that day to 6 months after that, we can accept the donor. So now that we know all the criteria for blood donation, so what do you say? Will you take this challenge and become a lifesaver yourself? And comment down below whatever queries you have. I will try to answer each and every one of them. And tag me whenever you donate. And don't forget to share this episode to spread the word. And until next Wellness Wednesday, stay safe, stay kind, help each other out, and keep the lifeline going. And yeah, I'll see you next time. Bye.